XELODA. Let's talk about it. XELODA is a pill that your provider, your oncologist, may prescribe to you following mastectomy, your traditional chemo infusions, radiation, all that stuff may get prescribed to you if they find any residual cancer cells at time of your mastectomy. Of course, if you have triple negative breast cancer, which is what I had. This is used as one last hoorah at getting rid of all those cancer cells that could be left floating around. Just because they found residual cells maybe in your breast tumor or your lymph nodes, it could possibly mean that there's little cells still floating around in your body even though they took those tumors out. So the XELODA is used to try and kill any of those little remaining cells floating around so they don't form tumors. Side effects. Clearly not hair loss. Haven't really experienced any hair loss with it, so that is promising. Is really hard on your digestive tract, your GI tract, in the sense of diarrhea. Haven't noticed any nausea or anything like that, not really any fatigue. I did start getting really bad mouth sores there for a while, to the point where I could even water burnt them. Yes, I tried the baking soda salt rinse, preventative mouthwashes, all that stuff, Miracle mouthwash, which is absolutely disgusting and I would rather starve to death than use that. But suffered with that for a few weeks, so my oncologist ended up decreasing my dose. I started out taking 4 of those beautiful little pills in the morning and 3 of the evening. I now take 3 in the morning and 3 at night. 2 weeks on, 1 week off. You also do that for 6 months. Also a side effect is hands and foot syndrome. Not to be mistaken with hands, foot, and mouth that children get. Hands and foot, it dries the palms and the soles of your feet out terribly. Look at my little crusty hand. I even just put lotion on these not long ago, and I am crusty. So crusty that the Omnicell at work that scans your fingerprint to let you in will not pick up my fingerprint anymore. So I would suggest a really strong lotion. Eucerin cream, Aquaphor are great moisturizers, but they rub off very easily. So it's hard to keep your hands moisturized. But those are my biggest symptoms that I have noticed so far. That's about it. My joints in my fingers hurt sometimes when I first started taking it. It's gotten better over time. Haven't really noticed that anymore. But overall, I would rather take XELODA than like AC or something like that. It's not that bad, and you gotta get it in your mind that you're just not taking it. It's just a sugar pill, and it's not doing nothing, and you're gonna be fine. I think they said like March 10th or somewhere around those lines might be my last one. But I don't even know because I ain't even counting because I ain't even taking it. It's fine. But if you're worried about taking XELODA, don't be. It's not nearly in comparison what you've been through. So you've got this.